The ICU monitor beeped steadily as Thomas Bradford opened his eyes. 72 years old, 2 fresh surgical scars, and a lifetime of secrets finally exposed. His temple throbbed where they'd removed the melanoma. His lower back ached where they'd extracted something else. A bullet. An American bullet. 53 years inside him. Dorothy's weathered hand gripped his. Their daughter Claire stood beside her, still wearing her white coat, exhausted but relieved. Both had been crying. Tom's throat was dry. "I'm alive?" "Barely," Claire whispered. He remembered everything now. The confession, the truth about Vietnam, about Captain Morrison, about the bullet he'd carried as penance for a sin he never committed. 2 scars, 2 wars, 1 body that had finally run out of places to hide. Sometimes, he thought, your body holds on to what your heart can't let go. Leave a like and share your thoughts in the comments along with the city you're watching from now. Let's continue with the story. 6 weeks earlier, autumn rain drummed against the windows of the Bradford home in southeast Portland. The craftsman-style house smelled of coffee and something sweeter. Cornbread baking in the oven, Dorothy's mother's recipe, passed down through 6 generations. Tom stood at the bathroom mirror, electric razor buzzing against his jaw. At 72, he still had the broad shoulders of a man who'd spent 40 years in construction, though his hands trembled slightly now. Every Sunday morning, the same ritual. Blue chambray shirt, careful shave, church with Dottie even though he'd rather stay home. His razor paused. There it was again, that spot on his left temple just above his ear. Darker than he remembered, larger too. He touched it with 1 finger, firm, slightly raised. How long had it been there? 3 weeks? 4? "Just a mole," he muttered. "Nothing." "You say something, honey?" Dorothy appeared in the doorway, silver hair still damp from her own shower, holding 2 mugs of coffee. At 70, she moved with the quiet efficiency of someone who'd taught elementary school for 35 years. Patient, observant, missing nothing. She handed him a mug and studied his face, her gaze fixed on his temple. "Tom, what's that?" "What's what?" "That spot above your ear." He waved dismissively. "Been there a while. Probably just a clogged pore." "That's not a pore." She stepped closer, frowning. "How long have you had it?" "I don't know. Couple weeks, maybe. It looks dark. Irregular edges." She reached up to touch it, but he pulled away. "Don't fuss, Dottie. It's nothing." "Tom." "I said it's nothing." His voice came out sharper than intended. He softened it. "Real men don't run to doctors over every little thing." She held his gaze for a long moment, the way she did when her students tested her patience. Then she sighed. "Your father said the same thing, and he died at 68. Tom's jaw tightened. "That was different." "Was it?" They stood in silence, steam rising from their coffee mugs. From the kitchen, the timer chimed. Cornbread ready. Dorothy turned away. "I'm just saying," she said quietly. "Maybe have someone look at it." After she left, Tom stared at his reflection. The spot stared back, a dark intruder on familiar territory. Behind him on the shelf sat a framed photo. Him at 22 in army fatigues, face lean and unlined, eyes holding something he'd spent 50 years trying to forget. He touched his lower back unconsciously, where an old scar lay hidden beneath his shirt. Shrapnel, he'd always said, a gift from Vietnam, some gifts you carry forever. The Home Depot smelled of lumber and concrete dust. Tom hefted a 2x4 onto his shoulder, the familiar weight comforting. Tuesday morning, the aisles nearly empty except for a few contractors grabbing supplies before job sites opened. He'd been touching the spot on his temple all morning. Unconscious habit now, like checking your phone or adjusting glasses. His finger found it again as he turned down the hardware aisle. The beam caught him off guard. A low-hanging display he'd walked under 100 times. His head clipped the edge. Minor contact, barely felt it. But then he touched his temple, and his fingers came away red. Blood. Not a lot, but steady. He pressed his palm against it, felt the warm trickle down his neck. Applied pressure like he'd learned in 100 construction site first aid sessions. The bleeding didn't stop. 5 minutes. 10. He grabbed paper towels from a display, pressed them to his head. They soaked through, red blooming across white like a flag of surrender. "Sir? Sir, you're bleeding pretty bad there." A young employee, maybe 19, face pale with concern. "It's fine, just a bump." "That's a lot of blood for just a bump. You should sit down." Tom waved him off, but his hand shook. The paper towels were drenched now. How much blood could one spot produce? It was barely larger than a dime. 20 minutes. The bleeding finally slowed to a seep. Tom paid for his lumber with crimson-stained paper towels pressed to his head, ignoring the cashier's worried glances. In his truck he sat for a long moment before starting the engine. This wasn't normal. Deep down, beneath the layers of stubbornness and masculine pride, he knew it. Dorothy saw him coming up the driveway. She was in the garden, tending her roses, each one named for someone important. She'd planted Claire's Peace the day their daughter was born 45 years ago. It had never bloomed right, never bloomed. One look at the blood-soaked towels and her pruning shears clattered to the ground. "Tom!" "It's nothing. Just bumped it." "Get in the car." Her voice had that tone, the one she used maybe twice a year, the one that meant don't argue. "Dottie, I can just—" "Thomas Bradford, get in the car right now." He got in the car. The urgent care waiting room felt like judgment. Young mothers with sick kids, an old man coughing into his elbow, a teenager with a swollen ankle, all of them with legitimate problems. And here was Tom, wasting everyone's time over a pimple that bled too much. The physician assistant was young enough to be Tom's grandson, fresh-faced, eager, thorough. Too thorough. He examined the spot with a light and magnifying glass, his expression shifting from routine to concerned. "How long has this been here, Mr. Bradford?" "Few weeks." "Has it changed? Grown? Changed color?" Tom shifted on the exam table, the paper crinkling beneath him. "Maybe. I don't know." The PA excused himself, came back with a supervising physician, Dr. Allen, a man in his 60s with gray temples and steady hands. He studied the lesion without speaking, then used a dermatoscope, a device Tom had never seen before. The silence stretched too long. "Mr. Bradford," Dr. Allen said finally, "I'm seeing irregular borders here, color variation, and that bleeding pattern is concerning." "Concerning how?" Dorothy's voice was tight. "I'd like to do a biopsy. Today." Tom felt something cold settle in his chest. "A biopsy? That seems extreme." "Sir, I'm going to be frank with you. This has characteristics consistent with melanoma." The word hung in the air like smoke. "Melanoma," Tom repeated. "That's cancer. We won't know for certain until we get pathology results, but yes, it's a form of skin cancer. Given the bleeding and appearance, I'd say this needs urgent attention." The biopsy took 15 minutes. Local anesthetic, a punch tool that felt like pressure more than pain. Stitches. Tom stared at the ceiling tiles and counted them, anything to avoid thinking about the word melanoma. "Results in 3 to 5 business days," Dr. Allen said, peeling off his gloves. "But I'm marking this urgent. My office will call you." The car ride home was silent for the first 5 minutes. Rain had started again, Portland's perpetual autumn drizzle. The windshield wipers beat a steady rhythm. "We should call Claire," Dorothy said. "No, Tom, we don't know anything yet. No point worrying her. She's a doctor. She should know. She's busy with her own life. And we're not speaking anyway, remember?" Dorothy's hands tightened on the steering wheel. "This is more important than pride." "I said no." The silence returned heavier now. Tom stared out the window at familiar streets made strange by fear. "I'm scared, Dottie," he said quietly. It was the first time he'd said those words in their 46-year marriage. Friday arrived like a sentencing. Tom spent the morning in his garage workshop, sanding a piece of oak he'd been meaning to finish for months. The repetitive motion usually calmed him. Today, each stroke of sandpaper felt like counting down to something inevitable. The phone rang at 1:30. Dr. Allen's office. His hands were shaking so badly he nearly dropped it. "Mr. Bradford, Dr. Allen would like to see you this afternoon. Can you come in at 3? The nurse's tone told him everything. Good news came over the phone. Bad news required an office visit. "I can be there," Tom said. Dorothy was already reaching for her purse. The waiting room clock moved like it was stuck in syrup. 2:45, 2:52, 2:58. Other patients came and went, an elderly woman with a cane, a young man with a rash on his arms, a mother with twin toddlers who wouldn't sit still. Tom wondered which of them were here for life-changing news and which for routine appointments. From the outside, you couldn't tell who was standing on the edge of a cliff. Thomas Bradford? Dr. Allen's office was smaller than Tom expected. Diplomas on the walls, a desk cluttered with files, a diagram of skin layers that Tom tried not to look at too closely. Dr. Allen didn't waste time with pleasantries. He opened a folder and slid a pathology report across the desk. Tom saw words he didn't understand. Atypical melanocytes, Breslow depth, ulceration present. "Mr. Bradford, the biopsy confirms melanoma." The room tilted slightly. Dorothy's hand found his. "It's a nodular melanoma," Dr. Allen continued, "which is an aggressive subtype. The Breslow depth, that's how deep it's penetrated, is 3.2 millimeters. There's also ulceration, which means the surface is broken down." He pulled out diagrams, showed cross-sections of skin. Tom watched the doctor's mouth move but only caught fragments. Vertical growth, deep invasion, stage 2B. "How long?" Tom heard himself ask. "How long has it been there?" "Given the depth, I'd estimate it's been growing for at least a year, possibly longer. Nodular melanomas can hide under normal skin until they suddenly change." A year. Tom had walked around for a year with cancer eating through his skin, oblivious. "What's the treatment?" "Wide excision surgery. Immediately. We need to remove the tumor with clear margins. That means taking out healthy tissue around it to make sure we get everything. We'll also do a sentinel lymph node biopsy to check if it's spread beyond the primary site." The words kept coming. 5-year survival rate, 70 to 80%. High risk of recurrence. PET scans every 3 months. Immunotherapy if it's spread. Tom heard the numbers differently. 20 to 30% chance of being dead in 5 years. He was 72. He might not see 75. Might never meet grandchildren Claire hadn't given him yet. They left the office with an armful of pamphlets and a surgery scheduled for the following Tuesday. In the car, Dorothy sat perfectly still, hands in her lap, staring straight ahead. Then she broke. "Why didn't you come in sooner?" Not angry, anguished. "I thought it was nothing. I didn't know—" "You never think anything's wrong." Her voice cracked. "Your father did the same thing. Ignored every symptom until he dropped dead at 68. You're 72, Tom. We should have had more time." "I'm not dead yet. But you could have been. If I hadn't pushed, if you'd waited another month—" She couldn't finish. Tom reached for her hand, felt how cold it was. "I'm sorry," he said. They sat in the parking lot as afternoon turned to evening, holding on to each other like shipwreck survivors. That night, Tom sat at the kitchen table, phone in his hand, staring at Claire's contact. Just her first name. No picture, no emoji. Not Claire Bear like it used to be when she was little. Their last conversation was 3 months ago. He'd called her about the divorce, tried one more time to talk sense into her. "Marriage is forever," he'd said. "You gave up too easily." She'd said things he didn't want to remember. He'd said worse. She'd hung up. Now he needed to tell her he had cancer. Needed to swallow 50 years of Bradford pride and admit he was scared. His thumb hovered over her name. It rang 4 times. He almost hung up. "Dad?" Her voice, surprised and guarded. "Claire, we need to talk. If this is about Jason again." "It's not. I have melanoma." Silence. Then her voice changed, shifting into doctor mode, professional and sharp. "What stage?" "IIB. Surgery's Tuesday." "When were you diagnosed?" "Today." "Jesus, Dad, why didn't you call sooner?" Then, softer. "What's the Breslow depth?" 3.2 millimeters, with ulceration." He heard her sharp intake of breath. She knew what those numbers meant. "I'm coming home." "You don't have to." "I'm coming. I'll be there tomorrow." "Claire." "Dad, I'm coming home." The line went dead. Tom sat holding the phone, something tight in his chest that wasn't cancer. Claire was coming home. After 3 years of silence, his daughter was coming home. It took dying to fix their family. Later, in his workshop, Tom opened the metal box he kept under the bed. Inside, a purple heart lay tarnished and untouched. Next to it, a yellowed envelope addressed but never sent. The letter inside was dated November 1971. He'd written it in a hospital bed with shrapnel. No, a bullet in his back. Written it to Captain Morrison, the man who'd shot him. He picked up the Purple Heart, read the citation for the first time in 53 years. "For wounds received in action against an enemy of the United States." The enemy had worn the same uniform he did. Saturday afternoon, Portland International Airport. Tom stood at baggage claim with Dorothy, his hands shoved deep in his jacket pockets. He'd changed his blue chambray shirt 3 times that morning before Dorothy told him to stop fussing. 3 years. He hadn't seen Claire in person for 3 years, though Dorothy video called her monthly when Tom wasn't around. He'd seen pictures, Claire thinner, tired lines around her eyes, hair cut shorter in a no-nonsense style that screamed physician. But pictures weren't the same as standing face-to-face with the daughter whose divorce he'd condemned. Passengers streamed through the arrival gate. Business travelers, college kids with overstuffed backpacks, a family reunion with balloons. Then Claire appeared, rolling a carry-on suitcase, dressed in dark slacks and a professional blazer. She looked like she'd come straight from the hospital, which she probably had. Their eyes met across 30 feet of airport terminal. Tom saw his daughter. Claire saw a patient, her physician's gaze going immediately to the white bandage on his temple, cataloging and assessing before she'd taken 3 steps. Then her professional mask cracked. Dad. Not doctor to patient, child to father. She crossed the distance fast and wrapped her arms around him. Tom hugged back, feeling how thin she'd gotten, how tightly she held on, like she was afraid he'd disappear. "I'm okay," he murmured. "I'm okay, sweetheart." "You're not," she said into his shoulder, "but you will be." The drive home felt like time travel. Claire in the back seat like she'd been 1,000 times growing up, but now studying her father's reflection in the rearview mirror with clinical precision. "When did you first notice the lesion?" 6 weeks ago? Maybe 8? Why did you wait?" Tom's hands tightened on the steering wheel. "Didn't think it was serious." "That's what kills people, Dad. Thinking it's nothing." Dorothy shot Claire a warning glance. "We're all here now. That's what matters." Claire sat back, jaw tight. Old patterns died hard. Tom's stubbornness met by Claire's directness, with Dorothy mediating between them like she'd done since Claire could talk. The Bradford house looked the same as Claire remembered. Same rhododendrons out front that her mother had planted before she was born. Same wooden porch swing where she'd done homework on summer evenings. Same everything, preserved in amber while the rest of the world moved on. Her childhood bedroom was exactly as she'd left it. Spelling bee trophies from middle school, Stanford acceptance letter framed on the wall, medical school diploma, family photos arranged chronologically. Baby Claire, gap-toothed Claire, graduation Claire, wedding Claire. Wait, no wedding photo. Claire scanned the wall more carefully. The wedding picture that used to hang by her dresser was gone. She opened the drawer, found it face down beneath old sweaters. Her father had removed it after she'd told him about the divorce, removed her marriage from the family history like it had never happened. She closed the drawer without comment. Pick your battles. Dinner was pot roast, her favorite growing up. Dorothy had spent the afternoon cooking while Tom paced the house, pretending to fix things that weren't broken. Now they sat at the kitchen table that had hosted 10,000 family meals, passing dishes with forced normalcy. "How's work?" Tom asked, cutting his meat into precise squares. "Busy. Emergency medicine never slows down." "That why your marriage didn't work? Too many hours?" The silence was deafening. Dorothy's fork stopped halfway to her mouth. "Tom," she said quietly. "No, it's fine." Claire set down her fork with deliberate control. "Jason's affair is why the marriage didn't work. 3 affairs, actually. That I know of." Tom's knife clattered against his plate. I didn't know that part." "You didn't ask? You just assumed I gave up, that I wasn't strong enough to fight for it?" "Claire, Let's talk about your surgery instead." She pulled out her phone, all business. "I reviewed your medical records. Dr. Allen sent them over. I need to see the pathology report." Tom slid the folder across the table. Claire opened it, her doctor's eyes scanning pages of medical terminology. Her face remained professionally neutral, but Dorothy saw her daughter's hand tremble slightly as she turned pages. "Stage 2B nodular melanoma, Breslow depth 3.2 millimeters with ulceration." Claire looked up. "Dad, this is serious." "I know." "No, I don't think you do. Nodular melanoma is the most aggressive form. It grows vertically, straight down through the skin layers. The ulceration means it was breaking through. Another few weeks and—" She couldn't finish. "But they caught it," Dorothy said. Right? They caught it, Doctor. Allen's surgical approach is sound. Wide excision with sentinel lymph node biopsy. If the nodes are clear, prognosis is good with surveillance. If they're involved, we're looking at stage 3 and immunotherapy. Tom studied his daughter's face. What are my real odds? Dad, as your doctor, as my daughter. Claire's professional composure wavered. You could have died if you'd waited another month. The ulceration means it was growing fast. We're lucky Mom pushed you to go in. After dinner, after Dorothy went to bed exhausted from holding fear at bay all day, Tom and Claire sat alone in the living room. The house creaked around them, old wood settling. Rain tapped at the windows. I'm sorry, Tom said, about what I said about your divorce. Claire stared at her hands. You weren't entirely wrong. I didn't fight for the marriage. But you don't know what it's like when someone you love keeps betraying you. I just didn't have any fight left. I should have asked why. Should have listened instead of judging. You're listening now. Took cancer to teach me. Don't say that. It's true. I've been a stubborn old fool my whole life. Claire moved closer, examined the bandage on his temple with gentle professional hands. Her eyes were wet. I can't lose you, Dad. Not when we just started talking again. You won't. I've survived worse. What could be worse than cancer? Tom almost told her. Almost pulled out the metal box and showed her the Purple Heart, the letter, the truth about Vietnam. But old habits held strong. Nothing, he said. Never mind. Sunday morning, church. Tom couldn't remember the last time he'd attended willingly, but today felt different. Claire sat between her parents like she had as a child, and for a moment, time folded in on itself. Tom prayed, not words, just an inarticulate plea. If you're listening, give me more time. I've got things to fix. The sermon, ironically, was about forgiveness. Holding grudges is like drinking poison and expecting the other person to die, the pastor said. Tom thought about the metal box under his bed, about Captain Morrison, about the bullet he'd carried for 53 years as penance for a sin he'd never committed, about Claire and the divorce he'd judged without understanding. How much poison had he swallowed? How much was still killing him from inside? Sunday brunch was sacred ritual. Dorothy's cornbread made from a recipe passed down 6 generations. Coffee. Radio playing soft jazz. Tom and Dorothy moved around the kitchen in the choreography of decades. She buttered, he poured, she plated, he served. Then You Send Me by Sam Cooke came on, their song. First dance at their wedding in 1978. Tom held out his hand. Dance with me. Dorothy's eyes shimmered. Tom Bradford, are you getting sentimental? Humor me. They swayed in the kitchen, barely moving, just holding each other. Tom breathed in the scent of her hair, same shampoo for 40 years, and felt the weight of everything they'd survived together. Vietnam, job losses, Claire's childhood illnesses, his parents' deaths, her mother's stroke, the 1,000 small crises that make up a marriage, and now this. Maybe the last crisis. 46 years wasn't enough, he whispered. Then we'll make it 92. Claire watched from the doorway, a stranger observing her parents' private language. When had she last seen them like this? She'd forgotten how they were together when they thought no one was watching. The tenderness her father hid from the world, but showed her mother in small moments. She wiped her eyes, thinking about her own marriage. Jason had never looked at her the way her father looked at her mother. Maybe that should have been her first clue. That afternoon, Claire spread Tom's medical records across the kitchen table, doctor mode, fully engaged. "Dad, can I see your back?" Tom looked up from his coffee. "Why?" "Your medical history mentions scar tissue on your lower back. Shrapnel wound from 1971. When's the last time it was x-rayed?" "Never. It's just shrapnel. Doesn't bother me." "Can I look at it anyway?" Tom hesitated, then stood and lifted his shirt. The scar was about 3 inches long, slightly raised, pinkish-white with age. Claire's trained fingers palpated the area gently. "Is it tender?" "A little. Probably just my age." Claire frowned. "It feels inflamed, and there's a firm mass underneath. Dad, this should be imaged." "It's been there 53 years. It's fine. Humor me. We're already doing pre-op workup for Tuesday. Let's add a spine x-ray." Tom pulled his shirt down, suddenly uncomfortable. "If it makes you happy." But something in his eyes made Claire pause. Not discomfort. Fear. Later, Jim Patterson stopped by. Tom's veteran buddy, same age, same war, same unspoken understanding. They retreated to the garage, Tom's sanctuary, surrounded by half-finished woodworking projects and the smell of sawdust. "How you holding up, brother?" Jim asked, settling onto a stool. "Scared. Don't tell Dottie." "She knows. They always know." Jim had his own cancer scare 5 years back. Prostate, caught early. He'd never forget the terror of waiting for biopsy results. The vertigo of mortality, suddenly made real. "Did you ever think about the war?" Tom asked. "When you thought you were dying?" "Every day. Still do." "You ever tell your kids? The real parts?" Jim was quiet for a moment. "Some. Not all. Some things are too heavy to pass on." Tom picked up a piece of oak, running his thumb along the grain. "What if those heavy things are the ones they need to know?" "Then you tell them. But you gotta survive surgery first, brother." Monday morning, pre-op appointment. Dr. Patricia Henderson was their surgeon, mid-50s, steady hands, the calm confidence of someone who'd done this procedure hundreds of times. She walked them through every step. Wide excision with 2-centimeter margins. Sentinel lymph node biopsy using blue dye to trace lymphatic drainage. 2 to 3 hours under general anesthesia. Recovery room, then home the same day if no complications. "What if it's spread?" Tom asked. "Then we adjust treatment accordingly. But let's take this one step at a time." Claire leaned forward, doctor to doctor. "Given the Breslow depth and ulceration—" "I know," Dr. Henderson said gently. "I'll be thorough. I promise." Tom signed consent forms, each one acknowledging risks. Bleeding, infection, scarring, anesthesia complications, death. Death. Right there in black and white, reducing the ultimate fear to another checkbox on a medical form. That afternoon, alone in his garage, Tom made a decision. He retrieved the metal box, took out the purple heart and the yellowed envelope, found a larger envelope, wrote on it, "Claire, if I don't make it, read this. Love, Dad." He sealed it and hid it in his workshop drawer labeled "Insurance Papers." Insurance of a different kind. A confession, in case he didn't survive to make it in person. Monday evening, Dorothy cooked Tom's favorites: pot roast, mashed potatoes, apple pie. Last meal before midnight fast. Claire helped in the kitchen, and Dorothy taught her the cornbread recipe. 6 generations of measurements and techniques passed from mother to daughter. "Why are you teaching me now?" Claire asked. "In case I'm not around someday. Someone needs to know it." "Don't say that, Mom. I'm just being practical, honey." At dinner, Tom sat at the head of the table, like always. Claire on one side, Dorothy on the other. It looked like every family dinner they'd ever had, but weighted with everything unspoken. "If tomorrow doesn't go well," Tom began. "Dad, don't. Let me say this." He looked at both of them. "You two are the best things in my life. Everything else, the work, the pride, the stubbornness, none of it matters. Just you two." Dorothy wiped her eyes. Claire gripped her water glass so hard her knuckles went white. "Real men don't cry," my father used to say. Tom's voice cracked. He was wrong about a lot of things. That night, Tom couldn't sleep. 2 a.m., staring at the ceiling, doing the arithmetic of his life. 22 in Vietnam, 26 when he met Dorothy at a church social, 28 when Claire was born, 72 now. 50 years of marriage, parenthood, construction jobs, mortgages, grandparents' funerals, friends buried, life lived. Was it enough? If he died on the table tomorrow, had it been enough? "Can't sleep?" Dorothy stirred beside him. "Thinking?" "About?" "Everything. Nothing. You." She moved closer, and they held each other in the darkness, skin against skin, heartbeat against heartbeat. 46 years of this, holding each other through insomnia and illness, through fights and reconciliations, through every season of life. "I love you," he said. "I know." "No, I mean, I love you. If I don't—" "Shh, you will. You're too stubborn to die." They stayed like that until dawn crept through the curtains, golden and merciless, bringing Tuesday with it. Surgery day. 4 a.m. Tom showered in the dark, maybe the last time in his own bathroom. He put on the blue chambray shirt like armor. Dorothy packed a bag with things he probably wouldn't need: phone charger, chapstick, a book he wouldn't read. Claire made coffee they couldn't drink. Ritual for ritual's sake. 5:30, the drive to the hospital through dark streets slick with rain. No one spoke. Everything had already been said. The radio played "Stand By Me," too perfect, too painful. Tom reached for Dorothy's hand. In the back seat, Claire watched her father's reflection, memorizing it. What if this was the last car ride? Portland Medical Center blazed with fluorescent lights. Registration desk, insurance cards, signatures. A hospital bracelet snapped onto Tom's wrist, reducing him to name and date of birth and allergy status. Pre-op area. Tom changed into a gown, his dignity left in a locker with his clothes, an IV line placed in his arm. A nurse reviewed his medical history for the 3rd time. The anesthesiologist explained how he'd go to sleep and wake up, and the very small risk that he wouldn't wake up at all. "Any chance I don't wake up?" Tom asked. "Very small, but yes. There's always risk." Claire's professional mask cracked. That's her father on the table. Not a patient. Her father. Dr. Henderson came by, marker in hand, and drew on Tom's temple where she'd cut. Clinical and matter-of-fact, but her eyes were kind. "We'll take good care of you, Mr.
Bradford. Make sure you get it all. That's the plan." Then it was just family. 3 people in a curtained cubicle, time running out. "We're ready for you," the transport nurse said. Tom looked at Dorothy. "I love you. 46 years wasn't enough." "Then wake up and we'll make it 92. He looked at Claire. I'm proud of you. Always was. Should have said it more. Claire's voice broke. Tell me after surgery. That's an order. Yes, doctor. They wheeled him away. Dorothy and Claire stood in the empty pre-op bay, holding each other, both crying. The waiting room had stale coffee and old magazines, and a TV playing morning news no one watched. Dorothy and Claire sat in molded plastic chairs designed for discomfort. The clock on the wall said 8:15. Surgery had started. Time moved like honey. 8:30, 9, 9:45. Mom, Claire said quietly. About the divorce. Not now, honey. I need to say this. Dad was right. I didn't fight hard enough. I was just so tired of... Your father was wrong. Dorothy's voice was firm. No one else lives your marriage. Only you know when it's over. He should have supported you. I should have told him about the affairs. He knows now. He'll apologize when he wakes up. Dorothy squeezed her daughter's hand. When? Not if. When, Claire repeated. They sat in silence, holding hands, waiting for their world to either continue or end. Operating Room 3, 8:15 a.m. Tom Bradford lay unconscious under general anesthesia, his body temperature carefully controlled, his breathing managed by machines. Bright surgical lights cast everything in sharp relief, every wrinkle, every age spot, every vulnerability of a 72-year-old body laid bare. Dr. Henderson scrubbed in, her surgical team assembled like an orchestra, preparing for a performance they'd done hundreds of times, but never took for granted. The melanoma site was prepped with antiseptic, turning Tom's temple a surreal orange-brown. Scalpel, Dr. Henderson said. The blade cut through skin layers with practiced precision. The melanoma revealed itself, dark, nodular, angry-looking against the pale subcutaneous tissue, uglier in person than on any scan. You see the irregular edges? Dr. Henderson said to the surgical resident, observing. Classic nodular pattern, aggressive vertical growth. She measured carefully. The tumor was 2.2 centimeters across, deeper than the biopsy had suggested, 3.5 millimeters into the dermis. It had been eating through Tom's skin for months while he ignored it, downplayed it, pretended it was nothing. Wide excision. Dr. Henderson cut a 2-centimeter margin of healthy tissue around the tumor, ensuring they captured every stray cell. The specimen went into a container bound for pathology. Frozen section analysis to confirm clear margins while Tom was still on the table. Next, the sentinel lymph node biopsy. Blue dye injected near the melanoma site, tracing the lymphatic drainage like rivers on a map. The first lymph node that appeared to drain the area, the sentinel node, would tell them if cancer had spread beyond the primary site. Dr. Henderson made a small incision, located the blue stain node, removed it carefully. It looked normal to the naked eye, but only pathology could tell them for certain. Sending sentinel node to path, she said. We'll close while we wait for results. 20 minutes of tension. The surgical team working in practiced silence, layering sutures to close the wound. Dr. Henderson focused on cosmetic closure. Tom would have a scar, but she could minimize it. The pathology phone rang. The scrub nurse answered, listened, hung up. Margins clear on the primary tumor. Sentinel node negative for malignancy. Relief rippled through the OR. Dr. Henderson allowed herself a small smile behind her surgical mask. Good news. We got it all, and it hasn't spread to the lymph nodes. She finished the final layer of sutures, placed a surgical drain, applied dressing.
2 hours, start to finish. Textbook melanoma excision. Tom would wake up cancer-free. Except he didn't wake up smoothly. BP dropping, the anesthesiologist announced. 90/60. Dr. Henderson checked the surgical site. Dry. No active bleeding. Volume status? Adequate. This isn't hypovolemia. Heart rate's irregular too. Possible arrhythmia. The cardiac monitor showed an abnormal rhythm. Atrial fibrillation. The atria quivering ineffectively instead of contracting with purpose. Could be anesthesia reaction, Dr. Henderson said, but her voice carried an edge of concern. Let's wake him slowly and get cardiology down here. They wheeled Tom to the recovery room, still unconscious but stable. A nurse hung additional monitors, watching his heart rhythm with hawk-like attention. Dr. Henderson pulled off her surgical cap, ran a hand through her hair. Melanoma surgery was successful, but cardiac complications were a complication she hadn't anticipated. 11:30 a.m. Dr. Henderson walked into the waiting room still wearing her scrubs. Dorothy and Claire stood immediately, reading her face like a diagnostic test. The surgery went well, Dr. Henderson said. We removed the melanoma with clear margins. The sentinel lymph node was negative, which means the cancer hasn't spread. Thank God, Dorothy breathed. But Claire's physician instinct caught the hesitation. He had a blood pressure drop and cardiac arrhythmia during emergence from anesthesia. He's stable now in recovery, but we're monitoring him closely. What kind of arrhythmia? Claire's doctor voice, not daughter voice. Atrial fibrillation, brief episode. Could be anesthesia-related, or it could indicate an underlying cardiac issue we didn't know about. Can we see him? Give him 30 minutes to wake up more fully. Then, yes. After Dr. Henderson left, Claire turned to her mother. Did Dad ever mention heart problems? Never. He's never even had chest pain that I know of. At 72, it's not uncommon, but still. Claire pulled out her phone, checking Tom's medical records again. Something was nagging at her. Dr. Henderson, wait. She caught the surgeon at the nurse's station. His medical history mentions an old injury on his lower back. I'd like imaging done while he's here. Full spine x-rays. Dr. Henderson frowned. For what indication? That's not standard post-melanoma surgery protocol. I examined the area yesterday. It's inflamed and there's a palpable mass. He's always said it was shrapnel from Vietnam, but it's never been imaged. Call it doctor's intuition? Dr. Henderson studied the younger physician's face. Sometimes the best medicine came from trusting instinct. All right. I'll order thoracic and lumbar spine films. We can do them while he's still in recovery. 12:30 p.m. A radiology tech wheeled a portable X-ray machine to Tom's recovery bay. He was semi-conscious now, groggy and confused. Mr. Bradford, we're just taking some pictures of your back. Stay still for me. Click. Reposition. Click. The image is uploaded to the hospital system immediately. Claire was waiting in the radiology reading room when Dr. Henderson arrived. They pulled up the spine series on the computer screen, scrolling through images. Thoracic spine. Normal. Vertebrae aligned. No fractures. No abnormalities. Lumbar spine. Normal, normal, normal. Then, at the L4, L5 level, something that made both women stop breathing. What is that? Dr. Henderson zoomed in. A metallic density embedded in the soft tissue adjacent to the vertebral body. Not fragments, not irregular shrapnel scatter. A distinct oval shape. Claire's finger trembled as she pointed. That's not shrapnel. Dr. Henderson measured it on screen. 9 millimeters. Military caliber. "No," she said quietly. "That's a bullet. An intact bullet." They stared at the screen in silence. "Has this ever been imaged before?" Dr. Henderson asked. Claire checked the records. "Never. According to his chart, it's always been documented as shrapnel wound 1971, but that," she pointed at the screen, "is a whole bullet." Henderson pulled up comparison views, measuring from anatomical landmarks. "Claire, look at this. Comparing to standard position, this has migrated medially. See? About 4 to 5 millimeters closer to the spinal canal than it should be. It's moving toward his spine. Yes. At this trajectory, it could eventually impinge on nerve roots. Worst case scenario, it penetrates the dura mater and causes spinal cord compression. That would cause paralysis. Or worse, this needs to come out." Claire's mind raced. Her father had carried this bullet for 53 years, calling it shrapnel. Why would he lie? How did an American military round end up in his back? Friendly fire accidents happened in war, but the shape, the intact nature, this wasn't a ricochet or accident. This was a point-blank shot. "I recognize this caliber," Dr. Henderson said. "That's American military ammunition." The implications hung between them like smoke. "We need to tell him," Claire said. "Let him recover from today's surgery first. But this is urgent. Could be months before it causes problems, could be days. There's no way to predict." 1:30 p.m. Tom was more awake now, the fog of anesthesia lifting. Dorothy sat at his bedside, holding his hand. When Claire entered, he managed a weak smile. "Dottie?" His voice was rough from the breathing tube. "I'm here, honey." "Did they get it?" "Yes, all of it. Clean margins and the lymph node was clear. Thank God." His eyes closed briefly. "Feel like I got hit by a truck." "That's normal," Claire said, her doctor mask firmly in place but cracking at the edges. "You did great, Dad." "When can I go home?" Claire exchanged a glance with her mother. "Soon, but we need to talk about something first." Tom's eyes opened fully, suddenly alert. "What kind of something?" "Dad, your back. The old shrapnel injury." His body tensed. "What about it?" "We took spine X-rays as a precaution after your cardiac episode. Dad," Claire moved closer. "That's not shrapnel." "Course it is. Got hit in 71. Dad, I've seen the images. That's an intact bullet, an American 9mm round." The color drained from Tom's face. His heart rate spiked on the monitor, setting off a warning beep. "You X-rayed my back?" Not a question. An accusation. "You had cardiac complications." It was standard workup. "You had no right." "Dad, this bullet is migrating toward your spine. It could paralyze you or kill you. We need to remove it." "Leave it alone." His voice was steel despite his weakened state. Dorothy leaned forward. "Tom, what's going on?" "Nothing. It's been there 53 years. It's fine." Dr. Henderson entered, drawn by the cardiac monitor alarm. "Mr. Bradford, it's not fine. The bullet has shifted position significantly. Based on its trajectory—" "I don't care." Tom's voice rose. "That bullet stays where it is." "Why?" Claire's voice broke. "Dad, why would you refuse treatment for something that could kill you?" The room fell silent except for the beeping monitors. Tom's eyes were wet, his jaw clenched against emotion, and anesthesia lowered inhibitions. "Because I deserve it," he said. Nobody moved. "What do you mean you deserve it?" Dorothy's voice was barely a whisper. Tom's composure shattered. Tears streamed down his face. I deserve that bullet. I've carried it for 53 years because I earned it. Earned it how? Claire asked. By being a coward, by refusing orders, by getting shot by my own captain. The words hung in the air like a grenade after the pin's been pulled. Dorothy's hand flew to her mouth. Tom, you told me it was enemy fire. I lied. His voice broke. I've been lying for 53 years. Dr. Henderson quietly slipped out, giving the family privacy. Behind the curtain, Tom Bradford, war veteran, father, husband, broke down completely. You want to know about the bullet? His whole body shook. I'll tell you about the bullet. Claire moved to his other side, and both women held on to him as 53 years of buried truth finally clawed its way to the surface. I was 22 years old. Third tour in Vietnam. Fire base outside Da Nang. The words came in gasps between sobs. Captain Morrison ordered us to neutralize a village. That's what he called it. Neutralize. I went in first, point position. There was no VC. Just families, old people, children. His hands gripped the bed rails. I saw a boy, maybe 12, hiding behind his mother. Morrison ordered me to fire. I couldn't. I put my rifle down. Dorothy was crying now, but stayed silent. Morrison came in, saw me standing there with my weapon down. He said, "You refusing an order, soldier?" I said, "Sir, there are children." He called me a traitor. Tom's voice dropped to a whisper. He shot me in the back while I was facing those children. Oh my God, Claire breathed. When I woke up in the field hospital, Morrison was there. He told me I'd taken enemy fire, shrapnel from a mortar. That's what the report would say. He told me if I breathed one word otherwise, he'd finish what he started. Tom looked at his daughter. I was 22, bleeding, terrified. I believed him. They gave me a Purple Heart for wounds received against an enemy of the United States. His laugh was bitter. The enemy wore the same uniform I did. Dorothy's hands shook as she gripped Tom's. 53 years of marriage, and he'd carried this alone. Tom, why didn't you tell me? Because I was ashamed. His voice cracked. I thought you'd see me differently. See me as a coward. A coward? Dorothy's voice rose. You saved children. You chose humanity over orders. I chose to disobey in combat. That makes me a hero. Claire interrupted, tears streaming. Dad, you literally took a bullet to save innocent lives. No. Tom's face twisted with anguish. I failed. I let Morrison shoot me instead of standing up to him. I've hated myself every day since. You were 22 years old, Dorothy said fiercely. A boy yourself. And you chose right over wrong when everyone else chose murder. Tom's whole body convulsed with sobs. 53 years of grief, guilt, and self-hatred breaking through walls he'd built before Claire was born. The monitors beeped frantically as his blood pressure spiked. Claire saw the numbers climbing. 180 over 110, his heart rate accelerating past 120, 140. Dad, you need to calm down. I can't. He clutched his chest. Can't breathe. The cardiac monitor screamed. Atrial fibrillation with rapid ventricular response. His heart rate hit 160 beats per minute, his heart muscle quivering uselessly. Get help! Claire lunged for the call button. Nurses flooded in. Dorothy was pulled back as the crash cart arrived. He's in AFib with RVR, a nurse shouted. BP 190 over 120. Tom gasped like a drowning man. His eyes found Dorothy's across the chaos of medical personnel. "Dottie!" Then his eyes rolled back. The monitor flatlined. "Code Blue! Code Blue! Recovery Room 4!" The announcement echoed through the hospital PA system. Dorothy screamed. Claire's training kicked in. She tried to push forward to help, but hands held her back. "Ma'am, you need to step out. Let us work. That's my father.
I know. We've got him." Hands forced Claire and Dorothy into the hallway. The recovery room curtain snapped shut. Through the gap, Claire saw her father's body jerking as they started chest compressions. "No, no, no!" Dorothy collapsed against the wall. "Don't you leave me, Tom Bradford. Don't you dare!" Inside, organized chaos. Dr. Henderson appeared from nowhere, taking charge. "How long has he been down?" 15 seconds, starting compressions now. "Get me cardiology stat. Charging to 200, clear." The defibrillator delivered its shock. Tom's body arched off the bed. The monitor stayed flat. "Resume compressions. Charge to 300. More compressions, breaking ribs to save a life. Another shock delivered. "Clear!" The monitor showed nothing for 3 eternal seconds. Then, beep, beep, beep. A rhythm. Not perfect, but a rhythm. "We've got sinus rhythm. Pulse check. I've got a pulse. Start amiodarone drip. Beta blockers. Keep him sedated. I want continuous cardiac monitoring and an ICU bed immediately." In the hallway, Claire held her mother as they both shook. 2 doctors walked past with grim faces. A janitor mopped the floor, trying to be invisible. The fluorescent lights hummed their indifferent song. 5 minutes felt like 5 hours. Dr. Henderson emerged, her scrubs dark with sweat. Dorothy and Claire stood, barely breathing. "He's alive. We got his heart back into rhythm." Dorothy's knees buckled. Claire caught her. "Can we see him?" "He's being transferred to cardiac ICU. He'll be sedated to let his heart rest. The emotional trauma triggered a massive catecholamine surge. Basically, stress hormones flooded his system and threw his heart into crisis." "How close did we come?" Claire asked, her medical training demanding facts even as her heart shattered. Dr. Henderson met her eyes. "Another 30 seconds and we would have lost him." She didn't finish. She didn't need to. Tom was moved to the cardiac ICU, a forest of monitors and IV poles surrounding his bed. Unconscious, intubated again for respiratory support. The steady beep of the heart monitor was the only reassurance that he was still alive. Dorothy took his left hand. Claire took his right, both women crying silently. "I'm here," Dottie whispered. "We're both here." Claire pressed her forehead to her father's hand. "I'm sorry, Dad. I shouldn't have pushed about the bullet. The stress—" "This isn't your fault," Dorothy said firmly. "I killed him by asking questions. He's not dead. He's not dead." Night fell. The ICU dimmed its lights. Nurses came every 15 minutes to check vitals, adjust medications, document everything in hushed efficiency. Neither Dorothy nor Claire left. They brought uncomfortable chairs and positioned them on either side of Tom's bed like sentries. Coffee appeared from somewhere. They didn't drink it, just held the cups for warmth. Midnight. Tom's hand twitched. Dorothy leaned forward. "Tom?" No response. Just the machines breathing for him, his heart beating under chemical control. "I know you can hear me," Dorothy said, voice steady despite tears. "You don't get to leave, not after 46 years, not when we finally know the truth, not when Claire just came home." She stroked his hand, the same hand that had held hers at their wedding, that had held newborn Claire, that had built their house and fixed 1,000 broken things. You fought off that bullet for 53 years. You can fight off this. You're not a coward, Tom Bradford. You never were. The monitor continued its steady rhythm. Small mercy. He was still here. Claire watched her mother's vigil, seeing a love that had endured half a century. Her own marriage hadn't lasted 7 years. She'd walked away when Jason betrayed her, assuming that's what strong people did, refused to accept mistreatment. But watching her mother refuse to accept death, fighting for her husband with nothing but words and willpower, Claire understood strength differently now. "Mom," she said quietly, "I'm sorry I gave up on my marriage." Dorothy looked up. "Oh, honey, you didn't give up. You escaped." "Dad was right, though. I didn't fight. There's a difference between fighting for something worth saving and fighting to stay in something that's killing you." Dorothy's gaze returned to Tom. "Your father fought for those children in Vietnam. He's fought every day since to be a good man despite carrying that guilt. Those are fights worth having. Jason wasn't worth fighting for? No, baby. He wasn't." They sat in silence, holding Tom's hands, willing him to keep breathing. 3 a.m. Claire dozed in her chair, head tilted at an angle that would leave her neck aching. Dorothy stayed awake, watching Tom's chest rise and fall with mechanical assistance. She thought about the metal box under their bed, the Purple Heart she'd seen but never questioned, the way Tom sometimes woke from nightmares, gasping, reaching for wounds that were decades old. She'd known he carried something heavy from the war. All the veterans did. Jim had his own haunted look. Larry from church flinched at fireworks. Michael down the street couldn't handle crowds. But she'd never imagined this. Her husband, shot by his own captain for refusing to murder children, carrying that bullet and that shame for 53 years, thinking he was a coward when he was the only hero in that God-forsaken village. "I love you," she whispered to his unconscious form. "I love you more now than ever. When you wake up, I'm going to tell you every day until you believe it. You are not a coward. You never were." The monitor beeped steadily. Outside the ICU windows, Portland prepared for dawn. Inside, a family held together by threads thinner than hope, waiting for a 72-year-old heart to decide if it had one more fight left. Wednesday morning, 6:45 a.m. Tom's eyes fluttered open to institutional ceiling tiles and the rhythmic hiss of oxygen. He was alive. Against probability and his own body's rebellion, he was alive. Dorothy's hand still gripped his, her head slumped forward in exhausted sleep. Claire sat in the other chair, doctor's coat draped over her like a blanket, eyes closed but not really sleeping. Tom tried to speak, but the breathing tube prevented it. He squeezed Dorothy's hand instead. Her head jerked up. "Tom!" She pressed the call button, then cradled his face. "Oh, thank God! Thank God!" Claire was instantly awake, physician mode engaged. She checked the monitors, assessed his alertness. "Dad, don't try to talk. You're intubated. Squeeze my hand if you understand." He squeezed. "You had a cardiac event yesterday after surgery. You've been sedated for about 18 hours. You're in the ICU, but you're stable now." Nurses arrived. Then doctor. Henderson and a cardiologist Tom hadn't met. They removed the breathing tube, an uncomfortable procedure that left him gasping and coughing. "Welcome back, Mr. Bradford," Dr. Henderson said. "You gave us quite a scare." Tom's throat was raw. "How long?"
2 days since your melanoma surgery. That went perfectly. Clean margins, negative lymph nodes, but you had a severe cardiac episode triggered by emotional stress. The memories flooded back. The confession, the bullet. 53 years of secrets vomited out in a hospital bed. He looked at Dorothy, then Claire. "You must think I'm a hero," Dorothy said firmly. "We think you're a hero." The cardiologist stepped forward, Dr. Patel according to his badge. "Mr. Bradford, your heart is stable now, but we need to discuss treatment. The stress-induced arrhythmia revealed underlying cardiac issues. You'll need medication and lifestyle changes." "And the bullet," Claire added. "We still need to talk about removing it." Tom's jaw tightened. "I told you." "We know what you told us," Dorothy interrupted, "and we know why you think you deserve to keep it. But Tom, you don't deserve that bullet. You never did." Later, when the doctors left and Tom dozed fitfully, Claire made a decision. She asked Dorothy for the keys to their house. "Why?" "Dad mentioned a metal box. I think it's time we looked inside." Dorothy hesitated, then nodded. "Under our bed. It's never been locked, just private." An hour later, Claire returned to the hospital carrying an old military-issue metal box, the kind soldiers kept letters in. Green paint faded to gray, rust spots at the corners. She'd lived in that house 18 years and never seen it. Inside, she'd found the Purple Heart in its worn velvet case, the citation typed on yellowed paper, photos of her father impossibly young in uniform, face still soft with adolescence, and an envelope, addressed but never sent. Captain William Morrison, Firebase Delta, Da Nang, Vietnam. Postmarked November 15, 1971. Return address, Thomas Bradford, Walter Reed Army Medical Center. Claire had opened it carefully, the paper brittle with age. She'd read it once, then twice, then carried it to the hospital like a sacred text. Now she sat beside her father's bed, Dorothy on the other side. Tom awake but exhausted, the kind of tiredness that lives in bones. "Dad, I went to the house. I found the metal box." Tom's eyes closed. "Claire, I read the letter, the one you wrote to Morrison." His whole body tensed. "You want to know what broke my heart?" Claire's voice shook. "That you forgave him 53 years ago. You wrote it down. I forgive you. But you never forgave yourself." She pulled the letter from her bag, unfolded it carefully. "Can I read it to you?" Tom didn't answer. Dorothy nodded. Claire began. Her voice wavered but held. "Captain Morrison, I write this from my hospital bed, knowing I'll never send it. But I need to say these words, even if only to myself. I forgive you." Tom's eyes opened, glistening. "Not because you deserve forgiveness. You shot a 22-year-old soldier in the back for refusing to murder children. You called it cowardice. You called me a traitor. But I choose to forgive you because I need to be free. I've been carrying your bullet in my body, but I won't carry your hatred in my heart." Claire's voice broke. She paused, collected herself, continued. "I refused your order because killing children would have made me the enemy we were supposedly fighting. I took your bullet because some costs are worth paying. You taught me that following orders isn't the same as doing right. Thank you for that lesson, even if you didn't mean to teach it." Dorothy was crying now, reading over Claire's shoulder. "I'm going home soon. I'll marry a girl named Dorothy. I'll try to be a good man. I'll try to forget you. But I'll keep your bullet. Not as a shame badge, but as proof that I chose humanity when it mattered most. May God forgive us both. PFC, Thomas Bradford." Silence filled the ICU room except for monitor beeps and the hiss of oxygen. "You knew," Tom whispered. Even at 22, you knew you'd done the right thing. Yes, Claire said. But somewhere between then and now, you forgot. Dorothy leaned close. Tom, why did you bury this letter? Why didn't you send it? Because Morrison threatened to finish what he started if I talked. I was afraid, and then years passed, and the fear became shame. I convinced myself I really was a coward, that I'd failed those children by not fighting Morrison harder, that I deserved the bullet and the guilt and all of it. Did you save them? Dorothy asked. The children in that village? Tom's face crumpled. I don't know. Morrison went in after they carried me out. I heard gunfire. I heard screaming.
I've spent 53 years wondering if my cowardice got them killed anyway. You weren't there, Claire said. Whatever Morrison did, that's his sin, not yours. But if I'd been stronger, if I'd stopped him— You were shot in the back, Dorothy said fiercely. You did stop him. You delayed him. You gave those people time to run, and you paid for it with 53 years of your life. Thursday afternoon brought an unexpected visitor. Tom was sitting up in bed, working with physical therapy to regain strength, when a nurse appeared with an uncertain expression. Mr. Bradford, you have a visitor. He says he's an old friend from the military. William Morrison. The room temperature dropped. Tom's heart monitor beeped faster. Dorothy stood. Tell him to leave. Wait. Tom's voice was hoarse. Let him come in. Tom, I need to see him, please. A man appeared at the door. 75 years old, weathered, and walking with a cane. His face had filled out from the lean young captain in Tom's memories, but the eyes were the same. Hard. Haunted. Morrison stood in the doorway, staring at the man he'd shot 53 years ago. Hello, Bradford. Morrison. Dorothy positioned herself between them, protective. Claire moved to her father's other side. Morrison's gaze went to Tom's temple, the fresh, surgical bandage. I saw the news. Local veteran recovering from cancer surgery. I recognized your name. You came to gloat? No. Morrison's voice was rough. I came to say I was wrong. Tom's bitter laugh hurt his throat. 53 years too late. I know. Morrison pulled a folded paper from his jacket. Tom's Purple Heart citation. The original. I wrote this. Wounds received in action against an enemy of the United States. You were the enemy I was afraid of, the one who still had a conscience. He stepped closer, despite Dorothy's warning glare. I shot 17 men in Vietnam. You were the only American. But you haunt me more than all the others combined. Good. Because you were right. Morrison's composure cracked. That village? There were no VC. I killed 4 people that day after you went down. 4 civilians. An old man, 2 women, a boy. Tom closed his eyes. The boy, 12 years old, hiding behind his mother. I've lived with that for 53 years, Morrison continued. I came to ask, can you forgive me? Long silence. The ICU machines beeped their mechanical rhythm. I wrote you a letter, Tom said finally. November 1971. Never sent it. Claire handed Morrison the yellowed paper. He read it standing, his hands shaking. By the end, tears streamed down his weathered face. You forgave me 53 years ago? Yes. Why? Because carrying your bullet was heavy enough. I couldn't carry hate, too. Tom looked at the man who'd shot him. But I'm getting that bullet removed. After 53 years, I'm ready to let it go. Morrison sobbed, deep, wrenching sounds from a man who'd locked emotions away for decades. I don't deserve this. No, you don't. But I'm not doing it for you. I'm doing it for me. I wish I could undo it. The shooting, the village, all of it. You can't. But you can tell the truth. To your family, to yourself. Stop carrying lies. Morrison wiped his face. Would you press charges? For the shooting? Statute of limitations passed decades ago, and I'm too tired to hate. Morrison extended his hand. After a long moment, Tom shook it. Not forgiveness exactly, not reconciliation, but an ending. Thank you, Morrison whispered. Don't thank me. Just do better than I did. Tell your truth before it kills you. After Morrison left, the room felt lighter somehow. Tom sagged against his pillows, exhausted, but something in his chest, where the guilt had lived, felt fractionally less heavy. I can't believe he just showed up, Claire said. I'm glad he did. Tom looked at his daughter. I've spent 53 years hating him, hating myself. That letter, he gestured to it, I wrote it when I was still clear-headed, before the shame twisted everything. 22-year-old me knew I'd done the right thing. And 72-year-old you needs to believe it too, Dorothy said. That evening, with just the three of them, Tom told them everything else. The other times he'd refused questionable orders, the civilians he'd helped evacuate, the small acts of humanity in an inhumane place, the friends he'd lost, the things he'd seen that nobody should see. Claire listened to her father's war, finally understanding why he'd been so hard on himself, so demanding of perfection, so afraid of weakness. He'd built a life trying to prove he wasn't the coward Morrison had called him. Dad, she said quietly, remember what you said about my divorce? That I gave up too easily? I was wrong about that. No, you were projecting. You thought refusing Morrison's order was giving up, and you've spent 53 years punishing yourself. Then you saw me refuse to stay in an abusive marriage, and it triggered all that self-hatred. Tom stared at his daughter, his brilliant, insightful daughter who'd somehow become wiser than him. I didn't give up on my marriage, Dad. I refused to accept abuse, just like you refused Morrison's order. We both said no when everyone expected yes. That's not weakness. That's courage. I should never have judged you. And I should have told you about the affairs, about why I really left. We both kept secrets that hurt us. Dorothy squeezed both their hands. No more secrets. No more shame. This family starts healing today. Tom looked at the two women who'd held vigil over him, who'd refused to let him die. I love you both, and I'm ready to let the bullet go. Schedule the surgery. Claire nodded, professional and personal, finally aligned. I'll talk to neurosurgery. But Dad, after we remove the bullet, you need to do something for me. What? Wear the Purple Heart. Put it on display. Stop hiding what you earned. Tom thought about the medal, tarnished and locked away. The citation that told a lie to protect a truth. The weight of honor he'd refused because he thought he didn't deserve it. Okay, he said. Okay. 3 weeks later, Tom was cleared for the bullet removal surgery. The melanoma site had healed well, the stitches removed, leaving a thin pink line on his temple that would fade with time. His cardiac medications had stabilized his heart rhythm. He'd gained back the weight he'd lost and was walking 2 miles daily. Dr. Michael Chen, the neurosurgeon, was precise and calm, exactly who you wanted drilling near your spine. The surgery would take 6 hours.
High risk because of Tom's age and the bullet's proximity to his spinal canal, but the risk of leaving it was higher. The night before surgery, Tom slept soundly for the first time in 53 years. No nightmares, no phantom pain from the bullet site. Just deep, dreamless rest. Dorothy woke him at 5 a.m. with coffee he couldn't drink and a kiss he could keep. "Ready?" she asked. More than ready. This time, the pre-op waiting felt different. Not fear, but anticipation. Tom was choosing to let go of something he'd clung to for half a century. The bullet had become part of his identity, his penance, his proof, his secret shame. Soon it would just be a piece of metal in a specimen container. Claire accompanied them, having extended her sabbatical to 3 months. She'd be in the OR as an observer. Dr. Chen had agreed, understanding that sometimes medicine was also about family. "Last chance to change your mind," Dorothy said, but she was smiling. "Not a chance." They wheeled him to the operating room. Tom looked up at the bright lights, felt the cold of the table beneath him, heard the surgical team's quiet efficiency. "Count backward from 10, Mr. Bradford," the anesthesiologist said. 10, 9, 8. He went under thinking about the children in that village, hoping some of them had survived, hoping his refusal had given them time to run. 6 hours later, Dr. Chen emerged from surgery, still in his scrubs, holding a small specimen container. Inside, a bullet, dark, corroded, smaller than expected after 53 years of mythic wait. "Surgery went perfectly," he told Dorothy. "Clean extraction, no nerve damage. He'll need physical therapy, but full recovery is expected." Dorothy stared at the bullet through clear plastic. "This has been inside him longer than I've known him." Dr. Chen nodded. "These old war wounds, they have a way of becoming part of who we are. Sometimes removing them is as much psychological as physical." Tom woke in recovery feeling light. Actually, physically light. As if someone had removed a backpack he'd been wearing so long he'd forgotten it was there. Claire was there immediately. "Dad? How do you feel?" "Lighter." He smiled, still groggy. "I feel lighter." Dorothy held up the specimen container. "Want to see it?" Tom looked at the bullet, the thing that had defined 53 years of his life. 9 millimeters of metal and guilt and misplaced shame. It looked so ordinary, so small. "That's it?" he said. "That's what I've been carrying?" "That's it," Claire confirmed. "It's nothing. Just a piece of metal. It was never the bullet that was heavy, Dad. It was everything you attached to it." The recovery was easier than the melanoma surgery. Tom was walking within hours, feeling strength return to his back. The scar would be larger than the temple one, but he didn't care. Both scars were honest now, proof of survival, not shame. 6 weeks passed. Tom gained strength daily. Physical therapy 3 times a week. Cardiac checkups showed stable rhythms. Oncology appointments showed no melanoma recurrence. His body, after 72 years and 2 wars, was finally cooperating. The Bradford house filled with life again. Claire stayed through October, then November, working remotely and rediscovering her parents. Dorothy taught her the cornbread recipe properly, not just measurements, but the feel of the dough, the sound of the crust when it's perfect. Tom spent hours in his workshop finally finishing projects he'd started years ago. The oak piece he'd been sanding when his biopsy results came became a jewelry box for Dorothy. Maple inlay, dovetail joints. A small brass plaque that read 46 years and counting. One evening, Claire asked about the Purple Heart. Are you going to display it? Tom pulled out the metal box, no longer hidden under the bed but sitting openly on his workshop bench. The metal gleamed, recently polished. The letter sat beside it, carefully preserved in acid-free paper. I've been thinking about that, Tom said. Not just display it. Use it. Use it how? There's a Veterans Day ceremony at the Portland VA. They asked me to speak. Claire's eyes widened. Dad, that's in 2 weeks. I know. I said yes. Veterans Day arrived cold and clear, the Portland sky, that crystalline blue that only comes after rain. The VA hospital's memorial hall was packed. Veterans from Korea, Vietnam, Gulf Wars, Iraq, Afghanistan, families, active duty personnel, young faces and old faces, all carrying their own wars. Tom stood backstage in his blue chambray shirt, his armor, with the Purple Heart pinned to his chest for the first time publicly. Dorothy and Claire sat in the front row, both trying not to cry before he even started. The introduction was brief. Thomas Bradford, Army veteran, Vietnam 1970 to 1971, Purple Heart recipient. Tom walked to the podium, looked out at the sea of faces, took a breath. I carried a bullet for 53 years, he began. Not because I had to, because I thought I deserved it. The room fell silent. I was 22 years old when I was shot, not by enemy fire, by my own captain, for refusing an order to fire on civilians. Children, his voice stayed steady. He called me a coward. I believed him for 53 years. He touched the Purple Heart on his chest. This medal citation says I was wounded in action against an enemy of the United States. Technically true. The enemy wore the same uniform I did. Murmurs rippled through the audience, some uncomfortable, some knowing. I'm here because earlier this year I ignored what I thought was a pimple. Turned out to be melanoma, stage 2B, aggressive. The cancer forced me to face medical care I'd been avoiding, and that medical care found the bullet I'd been hiding. Tom's voice grew stronger. My daughter, she's a doctor. She taught me something. She said, Dad, sometimes saying no when everyone expects yes is the bravest thing you can do. I'm not a hero for refusing that order. I was just a scared kid who couldn't pull the trigger on children. But I'm not a coward either. And for anyone here carrying moral injury, carrying shame for doing the right thing in impossible circumstances, you're not cowards. You're survivors. He paused, looking at the young faces in the crowd. Don't wait 53 years like I did. Don't carry bullets, literal or metaphorical, because you think you deserve them. Talk about it. Get help. Forgive yourself. Because freedom isn't free, but healing is possible, and you don't have to do it alone. The standing ovation lasted 3 minutes. Veterans young and old stood, many with tears streaming. Tom saw a young man in the third row, mid-20s, wearing an Army combat patch from Afghanistan, crying openly. After the ceremony, that same young veteran approached. Sir, I'm Brandon. I refused to fire at a checkpoint in Kandahar. Civilians, kids. I lost rank, got Article 15, dishonorably discharged. Everyone called me a coward. What's your name, son? Brandon Davis, sir. Brandon, you did the right thing. Don't let anyone tell you different. How do I stop feeling guilty? Tom put his hand on the young man's shoulder. One day at a time, talk about it. Don't wait 53 years like I did. You've got time to heal. Use it. Brandon nodded, wiping his eyes. Thank you, sir. I needed to hear that. Other veterans came forward with their own stories: PTSD, moral injuries, hidden wounds that never made it into VA records. Tom listened to each one, no longer hiding behind walls of stoicism. Jim found him after, gripping his shoulder hard. "Proud of you, brother. Took long enough, but you got there." 3 months later, Christmas morning, the Bradford house sparkled with lights and smelled of pine and cinnamon. Extended family filled the living room. Dorothy's sister, Jim, and his wife, Claire, who'd finally made her extended stay permanent, deciding Portland needed her more than the hospital 3 states away. Tom cooked breakfast, using Dorothy's recipes but making them his own. The kitchen was his workshop now, another place to create. On the mantel, displayed in a small shadow box, the Purple Heart, the letter to Morrison, and the bullet mounted on velvet. Not hidden. Honored. The caption read, "2 bullets, 2 wars, 1 survivor." Dorothy found him staring at it. "What are you thinking?" "That it's finally just history. Not shame. Just something that happened that I survived." She wrapped her arms around him from behind. 46 years and counting, remember? How could I forget? Claire appeared, carrying a wrapped frame. "I made you something." Inside was a photo from the VA ceremony. Tom at the podium, Purple Heart on his chest, looking strong and whole and finally at peace. Below it, a quote in calligraphy: "Freedom isn't free, but healing is possible, and family is forever." Tom's eyes filled. "Thank you, sweetheart. Thank you for coming home, Dad. All the way home." They gathered for the traditional Christmas toast. Tom raised his glass, surrounded by everyone he loved. To second chances, to saying no when it matters, to saying yes to healing, and to family, the one that holds you together when you're falling apart. "To family," everyone echoed. Later, Tom stood at the window watching snow begin to fall. Rare for Portland. His reflection showed a man with 2 fading scars and no secrets. The temple scar barely visible. The back scar healing pink and clean. Behind him, laughter and warmth. The radio playing "Stand By Me." Dorothy calling him back to the table. Claire teaching her aunt the cornbread recipe. 72 years old. Cancer survivor. War survivor. Finally free from bullets he'd carried too long. Sometimes what almost kills you, a pimple, a bullet, the truth, ends up saving your life, he thought. Mine did. All of them. Tom Bradford turned from the window and walked back to his family, leaving his reflection and his shame behind in the glass. Sometimes the heaviest weight we carry isn't visible on any X-ray. Tom Bradford spent 53 years believing he was a coward for refusing to kill children, carrying a bullet and shame that nearly destroyed him. But here's what broke my heart and healed it at the same time. He'd written himself a letter of forgiveness at 22, then spent 5 decades forgetting he'd already known the truth. How many of us are living the same story, carrying guilt for doing the right thing when everyone expected wrong, punishing ourselves for choices that actually saved our souls? Tom's melanoma forced him to face not just cancer, but the lies he'd been telling himself. And in that hospital room, surrounded by the family he'd almost lost, he finally understood. Healing isn't about being strong enough to carry pain forever. It's about being brave enough to let it go. His daughter said it best. Sometimes saying no when the world expects yes is the most courageous thing you'll ever do. What burden have you been carrying that was never yours to bear? And what would freedom feel like if you finally set it down? Share your thoughts in the comments below. Your story might be exactly what someone else needs to hear today.